Hello, this is FC Billing here. We are a full cycle billing company with 20 years of experience. Our services include everything from insurance verification, insurance enrollment, and billing and posting claims. Today, we're going to be talking about modifiers in behavioral health billing, specifically modifiers 59, 76, and 91. These modifiers help clarify whether a service was repeated, performed during a distinct session, or involved special circumstances. In behavioral health settings, providers often deliver recurring sessions, repeating procedures, or complex treatment plans, so the correct use of modifiers is critical. And these modifiers, 59, 76, and 91 specifically, are commonly misunderstood, leading to costly denials. First, let's clarify Modifier 59. Modifier 59 is used to indicate that a procedure or service is distinct or independent from other services performed on the same day. It's most often used when two procedures are not normally reported together but are appropriate under the circumstances. Some examples of when to use Modifier 59 in behavioral health are when a patient receives both group and individual therapy on the same day and both are medically necessary, when two timed services are performed in separate, non-overlapping time periods, for example, morning and afternoon sessions, and if services are performed at different locations or by different providers and no other specific modifier applies. Some important points to keep in mind about Modifier 59. It is not for evaluation and management services or E&M services. For E&M codes, use Modifier 25. Modifier 59 is mostly used as a last resort when no other specific modifiers apply. Documentation is necessary when using Modifier 59 to show support for why the services are separate and distinct. Moving on to Modifier 76. Modifier 76 is for repeat procedure or service by the same provider on the same day. This modifier signifies that this repeat service is not just a duplicate billing error, but it was actually medically necessary. Some examples of when to use it. You can use it for repeat testing if a psychological or neurobehavioral test is repeated due to clinical need, for example, if new symptoms or a change in condition happens, by the same provider on the same day. Another example is multiple crisis interventions for a patient who would require two separate crisis interventions by the same provider in one day. Some important notes to keep in mind about Modifier 76. This is also not for E&M codes. You also will need clear supporting documentations for this modifier as well. Lastly, we have Modifier 91. Modifier 91 is used for repeat clinical diagnostic lab tests performed on the same day for the same condition. Some examples of when to use Modifier 91 in behavioral health. You can use it for drug screening if a patient is in a substance use program and requires multiple drug screens in one day for ongoing monitoring. You would use Modifier 91. Another example is monitoring medication effects. If a psychiatric medication requires repeat lab testing, for example, metabolic panels, on the same day due to abnormal results. And some important points to keep in mind about Modifier 91. These are for lab tests only. They are not for therapy or E&M services. You cannot use Modifier 91 for specimen or equipment errors. It is not allowed to use this modifier if the repeat test is due to a failure of equipment or specimen. Supporting documents is of course needed for this modifier as well to show why repeat lab tests were done. Some best practices to keep in mind for using modifiers. Make sure you are documenting thoroughly throughout the entire process. Clearly document the clinical reason for multiple or distinct services, including times and results. Always use separate claim lines. Bill each distinct or repeat service on a separate claim line with the correct modifier. And of course, train your staff. Share this information with all of your billing and clinical staff so that they understand when and how to use each modifier. That is it for today's presentation. If you have any questions, feel free to comment them below, or you can contact us directly via our website, www.myfcbilling.com, or call us at 540-609-7404. If you are looking for a team of experts to take care of your billing for you, please reach out to us. We would love to help make sure all of your claims and services are getting paid the maximum amount. Thank you so much for tuning in and have a great day.